final speaker for the afternoon, Mr. Bob Sideleau, who, yes please, round of applause, he's an AIDS survivor of 6 years. 6 years. Okay, is this good? Okay. Mr. Sideleau has done a great amount of work for the HIV/AIDS policy in Connecticut. Today he's going to talk to us about the Ryan White Care Act and his work with that. So please give it up for Mr. Bob Sideleau. Thank you.
Thank you. How is everybody today? Come on, I want to hear your voice. How is everybody today? Excellent. I've walked in the Greater New Haven AIDS Walk for several years, and I think it's a great day to be outside and to let people know that HIV and AIDS is still here, that people with HIV and AIDS still have needs. Everyone is here today because they are either HIV positive, have AIDS, know someone who has AIDS, or cares about HIV and AIDS in our community. Every year, new people are infected with HIV, and others receive an AIDS diagnosis. When was the last time you were tested for HIV? And if you know you're HIV positive, when was the last time you saw your doctor? As a person living with HIV and AIDS, I can tell you, people with HIV and AIDS face challenges every day. 15 years ago, when someone was diagnosed, there was a real chance they would die in a short time. Today, with early diagnosis and improved medications, a person with HIV has a really good chance of living a normal life. We're here today because we want to make sure that the New Haven community hears our voice. People living with HIV and AIDS are all around us. Some people are out about their HIV, friends and family who had the courage to tell us they're HIV positive, but there are many people who live among us who haven't disclosed that they're HIV positive, whether it's because they're private individuals or they're afraid to tell someone because of fear or stigma. We're here today for everyone to hear our voice, to hear that people with HIV and AIDS need access to health care, need access to medications, need access to housing, need help paying for basic things like electricity, heat, and food. We're here to let people know that there is help if you have HIV. If you have HIV, you can get medical care from programs like Medicaid, Medicare, and the Ryan White Care Act. But those government programs are only as good as the funding they receive. Each year, many programs that help people with HIV and AIDS suffer funding cuts. In 2007, the Ryan White funding from the federal government was cut by over $1.5 million to here in New Haven and in Hartford. But thanks to the advocacy efforts of the AIDS Life campaign and the HIV community working together, they united their voice, and the Connecticut legislature heard them and listened and helped to restore the lost funding from the federal cuts from state funds. Be sure to call your legislators, thank them, and for helping to ensure services for people living with HIV and AIDS. Services that keep people in housing and with heat and electricity, in medical care, and taking essential medications. Services that keep people alive. New Haven has the highest number of HIV and AIDS cases in the state of Connecticut. At the end of 2007, the state reported that there were 1,500 people living with HIV and AIDS in New Haven, and more than 10,000 people living with HIV and AIDS in the state of Connecticut. Those are only the people who have been tested. Many more people walking around afraid to get an HIV test or don't even think they should get one. Get tested. Know your HIV status. Let your voice be heard. Talk with family and friends about HIV. Encourage people to get tested. An HIV diagnosis should not be a moral judgment. It is a health condition. An HIV diagnosis, use your voice to help end the stigma that follows people living with HIV and AIDS. Talk about HIV and let everyone know that HIV is a virus, not a judgment on lifestyle or past behavior. HIV isn't a gay disease or a disease of the intravenous drug user or poor people or people of color. It is a disease of the human body. It is an illness that people can get. It doesn't discriminate, and it doesn't judge. Let your voice be heard that HIV and AIDS are medical conditions that need medical treatment along with family and community support. Being diagnosed with HIV and AIDS doesn't mean a person should be discarded or given second-rate care. Every day, people with HIV and AIDS go to work, pay taxes, drive cars, eat in restaurants. They're just like you. And if you haven't been tested, they might be you. Whether you or someone you know is HIV positive, let your voice be heard. Speak out. Make a difference. The only way that our community as a whole can improve is if we support each other. Use your voice and help others understand HIV and AIDS. Use your voice to end stigma. Use your voice to ensure that health care and medication is there for those who need it. Let your voice be heard today and tomorrow. Now, let's have a great walk through New Haven and show the HIV community that New Haven cares about HIV and AIDS. I'm Bob Sideleau. I'm a person living with HIV and AIDS, and I want to hear your voice with mine. Have a great walk. Thank you.